Hi, I'm Dr. Rachel Kalin, and you're watching the Weight Loss Surgery Channel.
Welcome to Weight Loss Surgery News. I'm your host, Leslie Thompson, and thank you for joining us today. In this week's report, can the government really help our children battle obesity? And what effect can a favorite ethnic dish have on your fat cells? One study shows it might actually keep you from gaining weight. Plus, learn how hypnosis convinced one woman she had weight loss surgery and find out what the results were. But first, the H1N1 strain of influenza, better known as swine flu, became epidemic around the world this spring. Although most westernized nations have been able to keep the disease in check, swine flu has had an especially devastating effect in countries where inadequate sanitation, brittle healthcare resources, and the generally poor health of the population have put large numbers of people at risk. But despite our advanced healthcare and sanitation systems, one group here in the U.S. is also at risk. A new survey of swine flu patients in California hospitals indicates that obese people are as at much risk of serious complications from swine flu as diabetics, pregnant women, and heart disease patients. CDC epidemiologists involved with the California outbreak were surprised by the frequency of obesity among the severe H1N1 cases. The CDC is said to, quote, be looking into the possibility that obese people should be given priority with other high-risk groups should a swine flu vaccination become available. But why would obesity make a person more susceptible to serious complications from swine flu? Some researchers suspect that obese people who can suffer from restricted breathing due to the amount of pressure on their lungs caused by the excess weight may have problems getting enough air and expelling congestion from their lungs when infected with swine flu. Margaret Chan, head of the World Health Organization, warned in an interview with Britain's Daily Financial Times newspaper that swine flu may reemerge stronger than ever, even if the current outbreak appears to be declining. As if the standard comorbidities weren't enough reason, given the possibility of a second wave of swine flu, it only makes sense to lose that excess weight. The healthier you are, the better equipped you'll be to fight off the virus and take care of others if swine flu comes to your town. In other news, New Mexico has a serious problem with childhood obesity. 17% of the state's children between ages 6 and 11 suffer from the disease. In response, U.S. Senator Jeff Bingaman has reintroduced a bill aimed at fighting obesity among children and adolescents in New Mexico and beyond. The Obesity Prevention, Treatment, and Research Act of 2009 is intended, quote, to comprehensively prevent, treat, and decrease overweight and obesity in our nation's populations. If passed by both houses of Congress and signed into law by the President, the bill would empower the federal government to develop a national strategy to combat childhood and adult obesity. Other federal agencies, communities, and healthcare service providers would presumably be called upon to work together in this joint effort. Medicare and Medicaid beneficiaries would also gain access to nutritional counseling and lifestyle activity programs under the proposed legislation. Senator Bingaman's proposal may or may not be the solution to the childhood obesity problem, but it represents a start at finding one. One thing is certain, with 1 out of 3 children in the United States either overweight or obese, we can't afford to do nothing. We're going to take a quick break, but when we come back, we'll pay a visit with the lovely Yvonne McCarthy. Then we'll go down to the shops for a Vindaloo and find out why curry may help you keep off those extra pounds. We'll be right back with more weight loss surgery news in just a minute.
Find out what's really going on in the bariatric community when the Weight Loss Surgery Channel brings you exclusive insider coverage of the 2009 annual meeting of the American Society for Metabolic and Bariatric Surgery from the Gaylord Texan Resort Hotel and Convention Center in Grapevine, Texas. We'll bring you the latest medical technologies, new surgical techniques, and groundbreaking research related to the treatment of obesity straight from the nation's leading doctors and healthcare professionals. The Weight Loss Surgery Channel is your all-access pass to the action. Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the Lap-Band AP system.
After weight loss surgery, it can be hard to get enough vitamins and nutrients in your diet. Bariatric Advantage offers a complete line of nutritional products specifically formulated to meet the unique needs of bariatric patients. Choosing to have weight loss surgery was a big decision and required a big investment. Learn how Bariatric Advantage nutritional supplements can help you get the most from your surgery by keeping your new body healthy and strong. Call us toll-free at 800-898-6888 or visit us online at bariatricadvantage.com.